Thank you very much, and thank you for being willing to be our guest moderator. We appreciate it. I'd like to take this opportunity to, first I'll introduce myself. I'm Dr. Carol Mountain. I'm the board president, and I'd like to welcome everyone to this virtual information forum. I'm excited that we all have this opportunity to review and learn about some of the educational modalities that were currently available for nursing. I hope that everyone finds this program educational and engaging. Next, I'd like to take this opportunity to introduce our board members. John Durking, who is our vice president, Alita Carpenter, Abraham Hill, Ken Maxey, Donna Norton, Tara Rooks, Melissa Rubalcava, and Cheryl Turner. I'd also like to acknowledge all the hard work from our nursing education consultants, and especially Dr. Cindy Fairchild, for her dedication to putting this program together. So thank you so much for being willing to spend your time to create this so that we all can learn some new things. And at this time, I'd like to turn the program over to the Executive Officer, Elaine Yamaguchi.
Thank you very much, Madam Chair. Welcome, everybody. We're all so glad that you could join us today. We think this is going to be a very, very interesting, informative program. And as Dr. Mountain has said, we really, BVNPT believes that we're really on the cusp of a very, very new way to teach nurses. So at this time, I did want to say thank you to everyone for joining us, spending some time with us. A big tip of the hat to our NECs, and of course, Dr. Fairchild, who, boy, has earned a whole lot of chocolate, I'll tell you. Am I to introduce our next speaker?
Yes, please.
Great. I will do just that. So the National Council of State Boards of Nursing, NCSBN, is an independent nonprofit organization, which surprisingly enough is a national council of state boards of nursing. Basically, they act together on matters of common interest. They provide a lot of research on policy and advocacy nationwide. They provide all the states and actually our neighbors in Canada and some other organizations outside the borders with an opportunity to share knowledge and help each other out. They also, of course, develop and administer the NCLEX. Here joining us today is Dr. Nancy Spector, who's NCSBN's Director of Regulatory Innovations. She's going to share some background and some information on NCSBN's research on what quality clinical experience really means and how it impacts direct care. Dr. Spector, are you ready?
I am ready. Can you all hear me? I don't know if you can see me. Okay, I am ready. Thank you so much for inviting me to provide that national perspective on what looks to be a fabulous program on simulation and clinical experiences. I really wish more of the boards would do something like this. I'd like to see all of you in person, but you know, sometimes there's benefits to doing it virtually because more of you can join us. Next slide, please. So these are the objectives for today. It's hard to talk about simulation or V-simulation without first talking about all of the types of experiences students have, including direct care clinical experiences or traditional clinical experiences. So we'll talk about that as well as the evidence. We are a regulation, as you know, both NCSBN as well as the Board of Nursing, and you need good evidence in order to make policy. So you need to have that available. And that, as Elaine said, is one thing that NCSBN can provide to the boards of nursing. And then I'll briefly talk about one of the studies that we're doing on COVID-19, looking at the impact on nursing education programs. You know, I only have 20 minutes, so I can't do any of this in a whole lot of depth. But next slide, please. So what is the evidence for clinical experiences, actual direct care, traditional experiences in PN education? There really is good evidence for direct care experiences. And we found that as we developed our evidence-based approval guidelines for the boards of nursing, we provide them with that. We did 2 years of study so that when they approve nursing programs, they'll be able to have evidence behind it so that they will be legally defensible. And again, you need that evidence for policy. So we do have evidence on traditional clinical experiences, but what about, again, I'm talking about the PN education programs, what about for simulation and virtual simulation? If you have a rigorous study that's a randomized controlled trial, it can be extended to the PN population, even if it was only done on RN programs. So NCSBN's simulation study, which really has become pretty well known now, was only done on RN programs, but that can be extended to PN programs because it was a randomized controlled trial. So there is evidence for simulation. What about virtual simulation? You know, and I'm going to talk about that a little bit later too. There really isn't a lot of evidence for virtual simulation in order for us to use it to change policy. In other words, to replace clinical experiences with it. With simulation, there is that kind of evidence. There is not yet for virtual simulation. And to be honest, it's not even there for RN education either. So, and we'll talk a little bit about that later. But next slide, please. I'd just like to tell you about the evidence that is available for traditional clinical experiences. Sometimes those get thrown aside, especially in this COVID-19 era, and you know, it's all about simulation and virtual simulation, but those are so important too. And I am just ecstatic that your board seems to think so and really has a robust number of hours that you require because they are so important. And our 2-year study found that. In this study, we did a integrative literature review, which is really a synthesis of all of the literature on the topic and research. Then a Delphi, which is looking at consensus of experts. So we had 295 experts in regulation, education, and those that work with new graduates that came to consensus on our approval guidelines. And then we used from the boards 5 years of their annual reports. 43 boards participated. We looked at their annual reports and what happened when programs began to not be approved or to lose their approval. Then also we looked at 5 years of site visits documents, and we had 31 boards that participated in that, which is pretty good because not all make site visits. And that's kind of that story of what's happening in the education program. That was qualitative research. So what did we find with all of these studies in terms of clinical experiences? Next slide, please. Well, this is what we found in terms of quality clinical experiences. No matter how many hours you require of your programs, they need to be quality hours. And these are some of the areas we found. Diversity of patients and settings, not just one place, not just one type of patient. Actual patients help to prepare that student for the reality of practice. And then the faculty, very important that they are competent when they are teaching students. We have found in some cases that faculty just weren't really prepared to teach in that particular clinical area. That is a huge finding of this study. And then the next two, a good relationship with the clinical partners and that the health facilities are willing to host students showed that when those were in place, we had better outcomes with those programs. So again, really shows the importance of that collaboration of faculty and nursing practice settings. And then some of the content areas, and we're regulations, so we look at those that are particularly related to regulation, delegation. With PN programs, that is absolutely so important that there be information on delegation in the program. Emergency preparedness, how could we not say that now after seeing what happened with COVID-19? Interprofessional communication, the most errors are made in nursing today because of lack of interprofessional communication. And then, of course, that time management or, priority setting. Now, no matter how many hours you have, you require of your programs, they have to be quality. I have seen situations where the student goes in, spends 8 hours in a clinic, stands there, does nothing, and, maybe does that 3 times a week, and that's considered 24 hours, but really not much has been accomplished. Next slide, please. So from these 3 studies, we have, or 4 studies actually, if you include the literature review, we have started NCSBN's annual report study or database. And what we're doing are collecting, most boards do annual reports. So we're collecting boards' annual reports. This is our pilot year. We have about 20 boards that are participating in this. And we've developed 52 evidence-based core questions that are the same questions, consistent across all of the boards of nursing that they're asking of all their programs. So we're creating that first ever nursing education database. And of course, down the line, we hope that all of the boards of nursing will join in this. And what makes it even better for the boards, we create for them their annual report. And also we'll put any additional questions that they would like. So it has really been a win-win situation for the boards of nursing. We have this year, hopefully not for too many more years, we have 16 questions on the impact of COVID-19 on the programs. And we have found, unfortunately, that there's been a huge impact. You probably know this if you're an education program out there. But what was really unfortunate is we asked a question compared to last year at this time, how would you compare the quality of the education your students are getting? Many of them, the majority of them said the same, but many of them said that they were worse than in other years. So that is really a concern. And one of the reasons, as you probably know, is that many students have been locked out of clinical sites. And, thus we've kind of gone to simulation and virtual simulation. One of the things that we're really proposing at NCSBN is that academic that academic practice partnership, that you really partner with the practice settings so that never would they call the student the visitor, but the student is always an essential worker. And that practice setting is has a very tight collaboration with the nursing program. So once we look at, these annual reports of these 20 programs, Brendan Martin is our researcher. He's our lead researcher at NCSBN. He's going to look at our results in the summer, and we might come out with some really good new findings. One of the things we would really like to find is, what is that minimum number of clinical hours necessary for graduating safe and competent students? There really hasn't been anything in the data on that by now, but maybe there will be. So next slide, please. So what about simulation? We've certainly seen a lot more about that in this time of COVID-19. And this is the definition that comes from the Healthcare Simulation Dictionary, which is a well-accepted definition of it. It creates that situation that allows you to experience the real event for the purpose of either practicing or learning, or maybe evaluating or testing, or to gain an understanding of systems or human actions. It can be high fidelity. Those are those big high-level simulation centers that you see with very sophisticated mannequins, or low fidelity, which are the task trainers, such as using an orange to do an injection, or case studies, role playing. Those are all low fidelity simulation. The healthcare simulation dictionary doesn't have a moderate fidelity, but there is a definition for that we used in our simulation study, and that is it's just more realistic than low fidelity. In other words, you use a mannequin, but it's not one of the really sophisticated ones, but it may have limited functions, such as being able to assess heart sounds or lung sounds. Next slide, please. So I have mentioned our simulation study, longitudinal randomized controlled trial, which should be able to be extended to PN programs. We had 10 programs across the US, all areas, and we studied for a year, and then 6 months into practice, it was the first study to look at, did this learning extend to practice? We had 10% simulation, 25%, and 50 in each program. And a key was that all programs had to have at least 600 hours of clinical experiences. Now, I know that you have more of that in California. And again, I think you're very lucky to have that. I can only tell you, looking at our annual report study and looking across the US, many programs have much less than that. And this study just wouldn't really apply to them. So let's see what those results are. Next slide, please. So we found that there was no difference in outcomes among the three groups of using 10% to replace clinical experiences, 25%, or 50%. And we found no differences at graduation and then at 6 months in practice. And in 6 months in practice, the supervisor did the assessing of the new graduate as well as the new graduate. Now, it's very important to know that we used a 1-to-1 simulation, a ratio of simulation to clinical hours in this study. A lot of times you hear out there, well, you can use 2-to-1. That's 2 hours of clinical to 1 hour of simulation because simulation is more intense. You might be able to. We don't know, though, because we don't have any robust evidence on that. So we do need to do more studies before we can say that. Next slide, please. There's another caveat to this study, and that is the program must incorporate the NCSBN simulation guidelines or other simulation guidelines. There is an international organization out there, an AXL, that also has great simulation guidelines, but you must have these kinds of components: administrative support, appropriate facilities, technology in place, the faculty needs to be trained, and the simulation personnel. And this is really critical. Policies in place. And, one of those policies needs to be about debriefing. Debriefing is probably the most important part of simulation. You need to have a recognized methodology, and all faculty need to be trained on this. So to just fly by night go out and bring in a simulator and say, okay, now we're doing simulation, we're going to replace 50% of our program with simulation, that's not going to do it. You have to meet all of these guidelines. Next slide, please. So what is the future in simulation? We're looking at our annual report study, and one of the questions we ask is, are all simulation faculty certified? Is your simulation center accredited? And we're not, not certainly fewer than 50% are, but this is something that we should look at in the future, because it is like in the traditional clinical experiences in simulation, it is that quality that makes a difference. We need more research on PN programs and simulation, and particularly, as we'll say, in virtual simulation. So what about our pre-licensure nursing education study, that impact on COVID-19? What have we found with that? Well, it's just started. We started in the fall collecting data, so we don't know what we found yet, but we can, kind of peek at some of the data. So far, we have 50 programs that are a part of this, maybe some of you in the audience are part of this, and it's a 2-year study, and we're looking at what is being done in terms of simulation, virtual simulation, traditional clinical experiences, and then what are the outcomes. We're looking at some of those standardized tests such as HESI, ATI. We're also looking at clinical evaluations of the students and other standardized tests. So that'll be really important after 2 years when we get these results to see what has worked and what hasn't worked in what we've been doing during COVID-19. So next slide, please. What about virtual simulation? We have definitely seen a lot of this during COVID-19, and some of the programs have replaced all of their clinical with virtual simulation. So I asked this question: is watching a video virtual simulation? Do faculty really know what virtual simulation is? Watching a video is not virtual simulation, and in some programs that's what faculty did in order for the students to meet their clinical experience hours. Is there evidence to support replacing clinical experience hours? Now, there are a lot of studies out there on virtual simulation, not a lot with PN programs, but there's a lot out there. It is at this point not rigorous enough that we could consider changing policy because of virtual simulation. There will be some ongoing studies on this. The more rigorous, the better, longitudinal, going into practice. Many kinds of programs included in the sample. Right now, we usually see only maybe 1 or 2 programs in the sample, and usually it's on one kind of an isolated thing like how to intubate or that sort of thing. It needs to be much more robust than that. Next slide, please. So what about the definition of virtual simulation? Again, this comes from that Healthcare Simulation Dictionary and is pretty simple. The recreation of reality depicted on a computer screen. So this is an emerging field and you really need to keep up with the literature. It may be portrayed in the virtual setting by a live actor or maybe avatars. There can be a variety of activities, such as using animation, video, gaming, that sort of thing, or multimedia where you have all kinds of different media, virtual patient simulation, online quizzes. It can support documentation, and especially electronic charting can be done very well with virtual simulation. And participants have reported increased confidence and psychometric skill tasks, but you know, you really have to do more than self-report because it's hard for the students to know where they should be. So we need to have more research on what is the actual outcome, and particularly comparing it to what faculty and what nursing supervisors and managers see. Next slide, please. So we can use virtual simulation for a lot of different areas, like scaffolding strategies across the curriculum. And by this, I mean, you know, you take one scenario, maybe you started out in foundations, and you use it across the curriculum. For example, you might focus on communication and foundations and take that whole scenario, the patient family, etc., and take it into adult health with prioritization and priority setting, that sort of thing. The pre-briefing is really letting that student know what the whole situation is, what the context is going on, and then you present the scenario, and then, just like in simulation, you need to have debriefing. So you have to have a debriefing strategy, and the whole thing needs to have a lesson plan. So again, you don't just say, oh, we've got COVID-19, you can't go into the clinical setting, watch all these videos. That certainly is not virtual simulation. And we did see that happen. Next slide, please. So what about virtual reality? And it's also called augmented reality. Honestly, this is where I think the future might be. This is when simulations use those 3D characteristics to replicate real life situations or healthcare procedures. And you know, if you've ever seen a holograph, it's like that. I was immersed in one of these once for an ER situation. It's fantastic. You honestly, you believe you're there. And in your role, you make those decisions for the patients. So it's very easy to teach clinical reasoning in this virtual reality. I'm really excited for how this will emerge in the future. So again, it's emerging. They often use these head-mounted displays, but there's other ways too. And again, it allows you to kind of navigate through the real world. I see this as the future of virtual simulation. Next slide, please. Last slide. The future in virtual reality, and again, from the regulators' viewpoint, because that's where we're coming from, we need more evidence. We particularly need more evidence with PN programs. So I would like to invite all of you that are in nursing programs especially, to apply for one of our Center for Regulatory Excellence grants. We give up to $300,000 for one grant. Start to research the virtual reality and simulation in PN programs. We really need more evidence on this. We need more education of faculty. They need to know what virtual reality is. Virtual reality is not just showing a video. This is an ever-changing technology, and we need to keep up on it. For example, I'm trying to help our education consultants in all of the boards to keep up on it. We had a guest in November that talked to us about virtual reality. We will have actually a demonstration on February 24th looking at virtual reality types. So we're trying to help at NCSBN, but we also invite you to have sessions like this, go to sessions like this, and really keep up on what's happening out there. So I thank you so much. My email, I didn't put it on the PowerPoint for some reason, is nspector@ncspn.org. Please feel free to contact me. And if there's time for questions, I would certainly like to open it up.
We will now be opening up for questions of Dr. Spector. If you would like to ask a question, you can click on the Q&A icon at the bottom right corner of your screen, and in the ask field, you can directly type in your question, and then we will present those questions to Dr. Spector. And again, we will be taking questions up until 9:35, so that gives us about 5 to 6 minutes for questions. So the first question, get my screen to scroll. They wanted to know if we could put the email in the chat. So we will do that before.
I can do that now.
Okay, if you would like to do that.
Sure.
And then let's see. Sue Simpson is asking if you could please repeat the grant opportunities for researching VR in LVN programs.
The grant program, is that what she wants?
Yeah, the grant opportunities for researching VR in LVN programs.
Okay, well, it's a grant that is open really to anybody. It's not just to LVN programs, or it's not just to regulators. It's to anybody out there that would be doing research that would have a relevance to regulation. Certainly, we need more research on virtual simulation, especially related to PN programs. So that information is available on our website, just ncsbn.org, and then click the research icon and look at the Center for Regulatory Excellence. And our next review period is in April, probably something like April 4th. I'm not sure the exact date. We review the grants twice a year, And, you know, we give a lot of money out because we really want to grow the body of research for our boards of nursing so they can base their decisions on the evidence.
Next question is, are we able to get a copy of the slides? This is great information, and this is from Noelle Kelsch from the Dental Hygiene Board.
Yeah, as far as I'm concerned, you may, yes, definitely.
All right, Dr. Spector's email has been put into the chat.
Mm-hmm.
I'm not seeing any additional questions at this moment. We will give it a few more minutes.
This is the moderator. I have a question from, it looks like board member Alita Carpenter. Would the grants be available for VR equipment for instructional programs, or must it be research related?
The grant is really not open just for equipment. If the equipment would be needed for a research project, it would be open for that, but not just, you know, equipment itself. The other thing that I would like to put out there, if anybody out there is a PhD student or a DNP student who is working on research, we do have a regulatory scholars program that will give up to $35,000 to a graduate student who is doing research. So that can be very beneficial as well. Like if you were a graduate student and you're doing virtual simulation and you wanted to buy those head glasses or whatever, you would be able to apply for one of those grants. What we're looking for though is the evidence. So we do need to have data, and it needs to be a research project. Again, that regulatory scholars program is in the same place on our website under the research icon, and that's called Regulatory Scholars Program.
All right, and we have one more minute if we have any additional questions. One question we have is, how can a program apply for a grant?
If you go to that website, ncsbn.org, click research and go to Center for Regulatory Excellence, there is the application right there. You can just pull it up and it tells you everything that's needed. It also gives you an idea about what other grants look like that were funded. So you can kind of get an idea about it. We've actually funded a number in simulation. I would like to see more in virtual simulation because clearly that is something that needs a lot more research.
This is the moderator. Looks like we have a question from another one of our board members. What is the current estimated cost of equipment per student?
Aha. That is one of those questions that I don't know, but I will find out. I actually have an appointment organization is going to send me one of the headpieces. I will find out what they cost, and I will let the Board of Nursing know that. That's a great question, though.
All right, and another question. I believe this is going to be for the VVMPT, but will the recording of today's event be available for registered attendees?
This is Elaine Yamaguchi. We have every intention of doing so. We should be able to put this up on our website.
Okay, and with that, we are out of time for questions for this item. Just so everyone is aware, if you do submit a question and we do not get to that question verbally, we are capturing the questions and we'll be providing those to BVNPT staff who can then provide questions or responses to those questions at a later time in writing. So for the next section of our program, we will be receiving presentations by the vendors that many of the programs use. Our first program that we'll be presenting is Garmin Clinical Simulation, and that will be presented by James Archetto.
Good morning, everyone, and thank you for that introduction. And what a treat to be able to present here today. I really appreciate that. And we're going to start with just a few comments from both Elaine and Dr. Spector. And I really appreciate the introduction provided by both. We are going to see in these next few minutes some new ways to educate nurses. And as Dr. Spector described also, we'll talk about high fidelity. The two simulators we'll be discussing today are very high fidelity. And you'll be able to see when Dr. Spector describes the real event, you'll be able to see the real event with the simulators that I'll be describing today. So the first one is called Victoria. And Victoria, as you can see, is a birthing simulator. So we'll start there. Next slide, please. We're going to start with our company. The background of our company is we're not one of these new companies that has just started with a headset and a 3D printer. We've actually been around more than 60 years, and we were started by a physician, and he saw gaps in medical education at that time. So really started producing full body and partial body OB simulators. We're an American company based in Miami. And interestingly, that physician's daughter is now our CEO. So we are a women minority owned business based in Miami. Next slide, please. We talk about realism, and Dr. Spector talked about the real event. And when we talk about fidelity, it is being faithful to the true event. So when you see these simulators, you'll notice the skin and how smooth and supple it is. You'll notice the anatomy, the sizes, the proportions are correct. This simulator we're going to describe, Victoria, she is the size of a full-size adult female. She weighs 150 pounds, and she does deliver a baby in quite a bit of detail, which we'll see in this slide deck in just a few moments. So next slide, please. What's interesting about babies, of course, is they're not always born in hospitals. And what's critically important is what we call care in motion. The baby may be born outside in the ambulance, may be born at home. And this simulator has to be realistic and be able to allow learners to really train for these low frequency, high risk scenarios. And one of the ways we do that is by keeping it untethered. There is no power cord plugging Victoria into the wall. She runs completely on a battery that'll last up to 10 hours. Likewise, she's wireless. She's controlled by a tablet, much like the one I'm using right now to display this presentation. So that all adds to that fidelity or that realism, which incorporates student engagement. Next slide, please. Also critical for this engagement is real monitoring. So this Victoria will allow the use of real monitors. If a nurse is being trained, we want that nurse to use the same equipment that that learner will use in their chosen setting, whether it's pre-hospital or in the hospital setting. So those fetal monitors, ECG monitors, defibrillators, you can actually defibrillate Victoria with real energy. We can put a pulse oximeter on her and you will get an O2 saturation reading. You can put a real blood pressure cuff on her. You see mounted on her abdomen right now a fetal heart rate monitor. and a toco monitor. And yes, using real equipment, you'll get a fetal heart rate and you can assess contractions with both of those monitors. So we talk about learner engagement and fidelity. It's not just the simulator that looks real, but the entire learning environment then becomes very realistic and allows the student to be engaged and really to take much more out of that learning environment. Next slide, please. When we look at the delivery, it's not just a normal delivery, as I described earlier, it's those low frequency, high risk scenarios that are most critical. A nursing student may not see a breech delivery or shoulder dystocia at all in clinical training. However, in simulation, that scenario can be repeated over and over, and that learner can gain valuable information during the debriefing process to understand what went well and what can be improved upon. So that realism becomes very critical in those scenarios I just described. Next slide, please. In addition to the mom, of course, the Victoria, is the birthing baby. And it's so important that that baby be realistic as well. And as you can see a little blue with this birthing baby. And she is full term. She is realistic size, realistic weight. She actually has an endoskeleton. She articulates just like a baby. She's very flexible. She's very slippery, which requires really the OB nurse or who's ever in that training to really be cognizant of what's taking place with that baby as the baby is being delivered. And notice the cyanosis. We could have the opposite as well. That baby could be crying after delivery with real heart and lung sounds. So using a standard stethoscope, a learner would hear actual heart and lung sounds on that very realistic looking baby. The next slide, please. We also talk about postpartum care, which is so critical as well, because we're looking at the full spectrum of OB education. It's not just the mom prior to the delivery. It's not just the baby during and after the delivery. It's postpartum care as well. So delivery of that placenta. And there are actually fragments that can be retained in utero, and the learner will have to find those fragments to ensure that the entire placenta has been delivered. Likewise, with a postpartum hemorrhage, the learner can learn how to assess for a postpartum hemorrhage to really determine how to treat that patient, whether it's a Bakri balloon or a fundal massage. Likewise, episiotomy repair and placental episiotomy repair, so the physician can suture the patient and practice that, again, in a very realistic environment and not on an actual patient. Next slide, please.
5 minutes left.
Okay. And the final is the software as to how it's controlled. And this software is all controlled via this tablet that I've described. And it is wireless, and it does come pre-packaged with these scenarios. And these scenarios are not just basic skills, but they involve critical thinking. They involve patient assessment. And there is, Dr. Spector described some of these mixed reality components that can be included. And here you see an example of a 3D animation that is superimposed with that patient. So with that, we'll go to, I believe, one more slide. And of course, we can talk about support and service for the simulators, which is critical as you're looking at this piece of equipment for your simulation program. So with that, I'll just stop and leave time for any questions that you may have.
This is the meeting moderators, and again, we have opened the Q&A panel for questions. If you would like to ask any questions, you can click on the Q&A icon on your screen and type those questions directly into the text field. If any board members have any questions, we encourage you to also provide your questions in the chat field. Not seeing any questions yet. Mr. Archetto, while we're waiting for questions, did you want to show the pediatric HAL video, or is that going to be too long?
The pediatric HAL video is 6 minutes, so that may be a little long for the time that we have here.
Okay.
But I'd be glad to forward that link to that video to anyone who would like to see that. It is very engaging, and as Elaine described at the onset, you can really gauge the progression of technology and how it will engage learners.
Okay, and a few questions that we have are, you mentioned easy to use software. How often does the software need to be updated, and are the software updates complementary with purchase?
It's a great question. The software updates we limit to 4 times per year, so once per quarter, and they are complementary with the purchase of the simulator.
Since the LVN role is limited in labor and delivery, do you have dedicated mannequins for outpatients so the investment can be meaningful?
We do. We're describing here this very high fidelity simulator, but as Dr. Spector described, there truly is a continuum of educational equipment that ranges from a very simple, something an LVN may be involved in, to very sophisticated, as you see here. So certainly there are plenty of options for learners specific, for devices specific for the LVN role.
Next question, has your organization identified any challenges or limitations for vocational nursing programs after purchasing Victoria and Newborn?
We have not. We work extensively with ADN, LVN programs, and of course, RN and DNP programs. And we have not found any specific challenges relevant to the type of program. So we're very adaptable and flexible to ensure that we're presenting the correct simulator for the program.
And what is the life expectancy of the battery?
The life expectancy of the battery is typically, depending on use, of course, and battery cycling, 2 to 3 years.
Next question, the simulation learning experiences package includes 10 scenarios. Do these 10 scenarios come with the purchase of Victoria and Newborn? And are there other scenarios that can be purchased as well?
The answer to both of those questions is yes. She does come with 10 standard simulated learning experiences, but there certainly are others that can be purchased.
Next question. Are there specific items such as placenta, cervix, etc., that need to be purchased after a certain amount of usage?
There are components that will wear over time. Certainly the birth canal is one of them. Our studies and our experience show that a birth canal and perineum will typically last for about 100 deliveries. And after that, it should be replaced based on use. So yes, there are items that do just wear out over time.
Next question. The training of faculty is included with purchase. Does the training include how to evaluate student learning?
That's really a function of the specific facility. So there are certainly, in the simulated learning experience, it is written to NCLEX guidelines and it is designed for that. But in terms of student assessment, we leave that up to faculty to really assess, to develop your assessment plan for your students.
Again, a reminder to the board members, if you have any questions, you can raise your hand and we can call on you to ask your questions. One additional question that's come in, how long is the warranty for this product?
The standard included with the simulator is a 1-year factory warranty that covers parts and labor due to manufacturer's defect. The reason I showed the last slide at the end is because most users opt for a service agreement, which is far more extensive and includes preventative maintenance, additional training, and care of the product. So summary, 1-year factory warranty that covers parts and labor due to manufacturer's defect, but a service agreement is far more inclusive.
Making one more check for any questions. This will be our last call for questions. For Mr. Archetto, board members, you can raise your hand. One more question has come in. How much?
Oh,
go ahead.
Apologies. This is a moderator. I see a question asked by board member Rooks. I may have missed it, but how much is this product?
Yes, you did not miss it. The price of the simulator, Victoria, as you saw, with everything we described, inclusive with the birthing baby, with the simulated learning experiences, and the warranty I described, is $62,500.
All right, seeing no further questions and having just about reached the end of our time for questions on this item, thank you, Mr. Archetto, for your presentation. We will be moving on to our next presenter now, and that will be from Wolters Kluwer, and the presenter will be Shannon Vorlick.
Hello. Hi. Glad to be here. And I'm Shannon Vorlick. I am a nursing instructor. I'm from Charleston, South Carolina. And thank you so much for allowing me to be here and share with you some things that we have learned and have come to find with using virtual simulation. And so just really going to kind of talk about how we've used virtual simulation to help build clinical reasoning in our students. So if you want to go ahead, you can move on to the next slide. And this is me. Just want to tell you just quickly a little bit about myself. I teach in an ADN program in kind of neat that I see that you have a multi-entry, kind of multi-exit program, and we have that as well. So our students can start off and come in and exit out as CNAs or nursing assistants, or as LPNs or LVNs, so which is really nice. I've been teaching since 2005 and have been using virtual simulation since 2012. So it's been a while, and I'm currently a student myself. Never thought I'd go back to school, but I'm going back to school to get my doctorate in education. So next slide, I'm going to just go over the objectives. I wouldn't be a real teacher, right, if I didn't have any objectives, but I'm just hoping in this little bit of time that I have with you that just going to talk about some adult learning strategies and how they've been using these strategies have been really helpful with VSIM, and how VSIM has helped grow those adult learning principles that we all know about, and how we can use it to build clinical reasoning and clinical judgment skills. So next slide. Just a quick little review, adult learners. I don't think we talk about this as much as we really should in education, in nursing education, but just to highlight some things that we know is that our adult learners, they want to be self-directed. They need some autonomy, right? And what's so important to give them is feedback. And I'm going to show you how using this virtual simulation has been able to provide quick feedback to our students. And they need to have those moments of self-discovery, right? They don't need to have the information just dumped to them. They need to have that moment of reflection. And our students, I know yours are the same way, they come with such a unique background and personal experience. And it's that experience that they have that's the key. And being able to relate it to experiences that they've had, taking care of other patients or their life experience, and being able to have that reflection. And we know our students come with such a variety levels of knowledge, so taking that into consideration. So I think you're going to see that kind of coming out as I demonstrate with you how our students use virtual simulation. So next slide. So this is taking you to as a student's perspective. Okay, so this little screenshot right here is if I was a student and I was going into our Course Point Plus and looking at it from a student's view. And I'm using, this is our fundamentals. This is what we use for fundamentals. And it's just a screenshot of the content. And when the students go in, they see everything kind of broken down into units or chapters of the content that they're studying. And they can go in and identify different resources that are available. But the thing that I love, if you look over to the left, and you can go to the next slide, is that the students can click on assignments. So the assignments that the instructor has chosen to assign to the students. And you can go ahead and move to the next slide. And in this list, they will see the things that they have to complete within the next week. And so for those adult learners, even though we have a due date, they can jump in and complete these activities whenever it works best for them. And this is just an example of if we were teaching skin integrity, wound care, those kind of things, some activities that we can assign. And everything that you see that's listed right here, the student's able to get quick feedback. And there's also an assessment piece. So for us as faculty, it's really nice that we can evaluate our students' learning as well as they go through these different activities. But what I want to focus on, of course, is the virtual simulation. So down at the bottom, what would happen is the student could click on that simulation, and it takes them into what we call a learning flow. So it's not just the simulation experience. There's a whole piece to it, the whole learning experience that the student has. When they first go in, you'll see over to the left that there are different steps. So at first, they're giving all the preparatory work. Okay, they get information about the patient. This is a patient who has a venous stasis ulcer, and the students are going to have to do a dressing change. on this patient. And they're given an S-bar, so they get a little story about the patient. And then they get all the resources that they need to prepare for this. And if you see, there's those little green SmartSense link. I have the little arrow pointing down to it. So the student is able to research the information in the ebook. It also goes along with the medications. It takes them to Lippincott Advisor. So if you look at the next slide, this is just an example. If the student is looking up the medication and they click on the green SmartSense link, it takes them to Lippincott Advisor, and they can read about this medication. And this is a clinical decision tool that is being used by practicing nurses. So they learn how to navigate through this, and they can look up the information so that they can be successful before they go in and complete the simulation. So you can go to next slide. And over to the left, I wish I could point out to you, but the next step is they complete a little pre-simulation quiz. They self-evaluate their learning prior to going in after they complete this preparation. And then the next thing they do, the third step, is the actual VSIM. So you can go on to the next slide. And this is what it looks like. Of course, it comes to life when your students are in it. And they are first introduced to the patient's EHR, and it gives them, again, a little story about the patient. And what I love about this, my favorite way to implement virtual simulation is in the classroom. Now, we use it in a variety of different ways. We use it for prep, as Dr. Spector was talking about, high fidelity versus low fidelity simulation. We'll have our students complete this before coming to simulation on campus and experiencing those high fidelity. And what's really nice is that, don't go yet. This patient, Josephine Morrow, this is an NLN patient that our students take care of in simulation. So they can complete this and do this at home and in preparation. And what we have found is it really helps to build their confidence. So when they're on stage in simulation and you know it's stressful for them, that anxiety is relieved a little bit. So, but again, my favorite is in the classroom. And one of the things that you can do is you can have your students walk through the critical thinking and clinical judgment process. So as my students are going in, I have them write down the things they notice. You know, what makes you go, what stands out? And interpret that information. And then we talk about it as a group. You could do a think, pair, and share activity. And then once you've kind of gone through the misconceptions that they may have, then you say, all right, now click the green button. You're going to take care of that patient. So next slide. Then they're at the bedside. And the students can pair up and do this together. Of course, they can be doing this at home in their security and they're doing it on their own. But again, I love doing it with the students. And they go through the scenario and go through all the different steps to take care of the patient. And when they are done, it will give them an immediate feedback on how they performed. So step by step, 10 seconds in, you introduced yourself to the patient. Or a minute in, you should have already identified that the side rail was down or something like that. It gives them very detailed feedback. So next slide.
5 minutes left.
Okay. And after the simulation, they take a quiz. So they get an evaluation piece afterwards. And of course, we as faculty get that as well, which is helpful. And the simulation itself is scored. It is meant to be a learning tool. This is meant to be formative. But you can, get a scoring and create set benchmarks for your student. Then they have the documentation piece. So over to the left, you'll see step 5 is documentation. We have our students document an academic EHR DocuCare, so they have specific things they need to document, and the virtual simulation will tell them, like, you need to document the changes in the patient's respiratory status, or you need to document the dressing change. So that's all part of it. And then last but not least, of course, is the reflection, which is huge. That's the debriefing. That's where they have to process the information, and that's where it sticks and starts to go into their long-term memory. And we've been using that opportunity as like a debrief with our students. So whether or not they complete this online, whether or not we do this in class, you know, a lot of faculty have been using this as clinical replacement. You know, Dr. Spector talked about that, using it as clinical replacement. But this is a wonderful way to debrief and take your adult learner and have them compare with the things that they already know and that they bring with them. All right, next slide. Mentioned Lippincott Advisor. One of the other things that, you know, is so nice is that for them to experience real world, okay, and real world practice. Lippincott Advisor is a clinical decision tool. So as they're preparing, they go through that clinical decision tool and they get to navigate through it. But they also have it as a resource, which is really nice. And you can go to the next slide. And students are able to go through and look up medications, diagnostics. There are problem-based care plans that are in here, which is what we're seeing in the facilities that they're using, nurses are using when they create care plans for patients. So those are also available as well. All right, next slide. This is just kind of shows you what it looks like. Everything that you see that's blue is hyperlinked. This is updated constantly. Weekly, they're updating it with the most evidence-based practice. So students, when they go in and they research and prepare for that virtual simulation, they're getting the most up-to-date information. Or if they're going into Lippincott Advisor for education to prep for taking care of patients, everything is the most up-to-date. All right, next slide. I mentioned to you about problem-based care plans. I do want to say I wish that we could have showed you the virtual simulation in a live experience. We will give you an opportunity to sign up and so that we can demonstrate. So there will be a follow-up invitation afterwards so that we can walk through this and how it works and seeing it all come to life that you can participate in afterwards. Next slide. This just shows you a problem-based care plan right here. Just want to give you a little example. It shows the infection. This is one example, infection risk, and it just takes you through the interventions. If you scroll through, the students have access to evidence-based journals, and that's an example on the next slide. I believe I show that. Yes, so instead of just having a rationale underneath interventions, each intervention, it takes them to a scholarly article, an evidence-based article. Next slide, which is what real nurses are looking at, right? This is where we go to when we're trying to find evidence. So great resources for your students, great for your adult learners in getting them ready for real practice. Any questions?
We are opening our Q&A panel again for questions. Members, if you'd like to ask a question, you can either type it into the chat field or raise your hand. For all members of the public, please type your question into the Q&A text field. Our first comment from Tara Rooks is, I like the evaluation at the end of the virtual simulation after the fact, but is there a setting in the program that could let them know during the simulation that will warn them they may be missing a step before it allows them to move forward?
Okay, that is a great question. And actually, it does not. And I can see where you're coming from, where you may feel that that's helpful. But what I found, and what a lot of us have found that have been using this, is that part of it is that recall. We want our students to put themselves in that situation and take what they've got so far in their bucket, I guess, of knowledge, and recall what they know, work through it the best way they think they know how, and then they get feedback and learn from it, and then they do it again. It's that repetitive experience. So that's part of the learning process. They can go in and repeat the simulation, virtual simulation, as much as possible to meet a set benchmark if that's set by the instructor.
Next question, what is the approximate cost of this program?
Oh gosh. So I'm a nursing faculty, and I am not a rep. I would not know the exact cost, but I do know that our rep, Sherry, is here, and I'm sure that she'd be able to answer that question. I know that your students can purchase VSIM, and it's as a standalone product. They offer VSIM specific for the LPN and LVN students. Also, if you're using an Enhanced Course Point Plus product, VSIM is included in that. And I believe she's on mute, so if you could unmute her, she could answer that question.
Hi, thanks, Shannon. Sorry, I didn't know how to take myself off. So, so Shannon kind of really wrapped that up. VSIM is sold standalone. However, in the platform or the view in which Shannon showed the presentation, that is included in a textbook. So we wrap them to our text so that you have context and content and context. So they remediate, the VSIMs remediate either back to Lippincott Advisor or sometimes back to the textbook. So if you're already adopters of our textbooks, we can wrap those up, and it creates a really nice discount. We'll be sending out an email for you guys to join us for a live demonstration, and we can dig into all of those things to the minutia if you'd like to, or you're welcome to send me an email for specific examples. I'll put my email address in the chat here. Thank you.
And the next question, how much does each scenario replace direct patient care?
Well, we definitely are not trying to say that this competes with direct care. I mean, nothing compares to hands-on taking care of patients. What we enjoy the most and what we feel has the most benefit for our students is that repetitive practice, that retrieval practice, as I mentioned, building confidence. So it's definitely a learning tool. Now, because of COVID, a lot of people have been using VSIM for clinical replacement, but of course that's up to your board of nursing for your state. But yeah, as far as replacing direct patient care, I can't give you a specific number. I hope that helped answer your question. I don't know if it really helped that much. I know that some states have allowed 1 hour per hour for the virtual simulation during COVID. But as Dr. Spector has stated, there's going to be some things I'm sure that they're going to be looking at differently moving forward.
All right, thank you, Ms. Vorlick. That is the end of our time for your presentation and questions and answers. We're going to be moving on to the next presenter now.
Thank you so much. Thank you.
Again, as a reminder, if you've asked questions that we did not get to, we will be collecting those to respond to at a later time. Our next presentation is from Bob Gillespie, and he is with EMS Simulation IQ.
Hello, everybody. Can you hear me?
Yes, we can hear you.
Perfect. I don't know if there it goes. Sorry. So just to get started, my name is Bob Gillespie. I'm the Regional Sales Manager with Education Management Solutions for our West Coast territory, from Seattle all the way down to San Diego, which obviously includes California. I don't know how familiar everybody is with EMS, but we are the industry leader in providing simulation programs with audio-visual hardware, cameras, microphones for recording of the simulations, which is very important for debriefing and viewing at a later time, as well as the management piece of the simulation program as well. A lot of institutions are doing a lot of simulation, but not everybody's necessarily tracking the outcomes that simulation's improving through the use of it, and that's where our system really comes into play. Next slide, please. I don't want to bore everybody with company facts and company overview, but at the same time, I do want to let you know who we are, so you don't think I'm just some Yahoo driving around California with cameras in my trunk. We were founded in 1994, so we're actually over 25 years old now. We are headquartered in Exton, Pennsylvania, which is a suburb of Philadelphia, which is also where I'm at right now. And if you could see out my window, we have some snow on the ground and are expecting more, unfortunately. I started with the company in 2009, at which point we probably had 50 or 60 employees. We've doubled our size, so we're actually close to 200 now. And, you know, we're obviously doing the right things, but we've been fortunate. We've been in a growing industry. Medical simulation has been growing by leaps and bounds, and we've been fortunate enough to ride that wave. Next slide, please. So since you can stay on this one, that's fine. So since our start, we actually have led the industry in terms of management software to track the outcomes that are being improved in center utilization as well as audiovisual. We started working with the high fidelity mannequins in 2004, and we also started offering distributed solutions as well in 2016, because a lot of programs we work with, hospitals and schools, might have multiple small sim centers that they want to tie together for one program, one curriculum, and to track the outcomes not only of their particular sim center, but also the entire program as a whole, if there's multiple campuses. Next slide, please. So we have a wide range of solutions, and I absolutely, it was hard for me to put together a couple slides to show you what we do and how we help institutions today, because we do offer so much. But I'd be happy if anybody's interested after the fact to do a deeper dive on any of these products. But from left to right, we do have a product called Simulation IQ IPE. I know there's been some discussion about the importance of interprofessional education, and that product is specifically designed for that. It's an entirely online web-based application where you can have individuals from different programs or disciplines working together on an online case. We also have a competency tracking platform. We have our core competency, Simulation IQ Enterprise, which we're going to talk about mostly. We have a lecture capture system, and then we also have a HIPAA compliant solution if any of the disciplines are doing training with real patients, that it has to be HIPAA, and the videos have to be HIPAA compliant and encrypted. Next slide, please. Some of the associations I've heard, Enaxel, we are a partner of Enaxel. We are a partner of the California Stimulation Alliance, SSH, and SimGhost. And another thing to point out, we're a Microsoft Gold certified partner. Next slide, please. So we have a wide range of clients. You know, we have institutions that don't even have dedicated sim spaces. So we have mobile and portable options. We have simulation programs that might have a couple rooms. And then we work with some of the largest simulation centers in North America. To the right there is SimLearn in Orlando, Florida. It's the main training hub for the VA hospital network. Next slide, please. So you may recognize some of these names. You may not. I'd be happy to introduce you to any of our clients. We have a ton of clients in California. That's a big stronghold for us. Next slide. So the nice thing about our solution is we provide it turnkey. We can provide all the hardware as well as the software. A lot of people think of us as the cameras and microphones, but in reality, we are a software provider. Next slide, please. So enough about the company. What we try to achieve with our solutions is, in the world of simulation, there's so many different things that you need to manage. You might have standardized patients with live actors or actresses. You might have the high fidelity mannequins from GOMAR. You might have virtual reality training from VSIM. You might have all these different things that you're looking to track and improve outcomes with your learners. Well, what do you use to manage it all, to bring it all under one umbrella to ensure that this training is actually improving outcomes? Because all this equipment is expensive. So how do you know that this is actually helping your learners become better physicians or nurses or, EMTs or whatever it might be, and hopefully save somebody's life one day? Next slide. What we do is we bring all of this under one umbrella, Simulation IQ. So you log into Simulation IQ to schedule the scenarios. You log into Simulation IQ to record the scenarios. You log into Simulation IQ to do the evaluations. And then lastly, but not least, to do the assessments and reporting. Next slide, please. So the system's based on three main pillars. First is to simply capture the information, whether it's a checklist, an evaluation, organize it, tie it to a certain discipline, tie it to a certain learner, or tie it to a certain campus. And then last, the analyzation piece. All this money, time, resources we're spending on simulation, how is this improving the outcomes of our learners? Next slide, please. So here's just a quick overview of the application. It's a web-based application that you can access from anywhere you have internet connectivity. As you notice there, you can have your username and password. A lot of institutions will allow their learners to log into the system to review pre-encounter information you want them to review before they even come into the simulation. That is especially popular now with COVID-19, limiting the amount of time people are coming together to do a simulation. A lot of this pre-work can be done at home. Once you log in, you come to your home screen. Next slide, please. Sorry about that. The home screen is where you would land, and it's driven by each individual. So this is the home screen for the administrator, the core educators. This isn't what all your learners would see or all your different faculty. So you can see, educators. So you can see there's a calendar. When are we doing different sims? When are we doing recordings? To the bottom right, you have a to-do list. So maybe you have to do an assessment on a learner that did a simulation earlier today. That's where that would populate. And then all the videos under My Items are there as well. If you look at the top tabs, it's really built with workflow in mind. The first tab is Items Library, which is where you keep all your questions, categories, competencies, everything you're looking to track in the simulation. You can then assign them to your cases and scenarios. Once you have your cases and scenarios, you can assign them to your sessions and courses. Once you have your sessions and courses, you can schedule them. You would then have video evidence of them, either live or playback. After you have the video evidence, you can either do evaluations live or playback. And then last but not least, you have that scores and reports. So it takes you through the entire workflow of a sim program. Next slide, please. So the system comes out of the box with some pre-populated cases and scenarios. And luckily for me, since I cover California, one of them is the California Simulation Alliance cases and scenarios, as well as the North Central Texas Healthcare Consortium cases and scenarios. So out of the box, you get about 50 free complementary scenarios that can be used with the high fidelity mannequins or the standardized patients. Next slide, please. It also has an electronic health record pre-built within it as well. So this can be part of the scenario or the encounter. That's something that you might want to assign the learners before they even come in, or have them document after the fact, so that they can, you can then review the video as well as the chart with the learners and debriefing. Next slide, please. So once you schedule it, you can then record the videos. And as you can see, we integrate with the high fidelity simulators. So we're able to capture the vital signs, the event logs, all that information coming from the mannequin, which is important, as well as different camera views, so that you can really enhance the debriefing with the power of the video. Because learners, they're so nervous during a simulation, and there's so many things going on. There might be a drop in heart rate, and they think they reacted to it right away. But in fact, maybe there was a delay. And that's where the power of the video comes in, where you can show them, hey, here's where, you reacted, which was a few minutes late. And then let's rewind that. This is where the heart rate actually dropped. And it's eye-opening, and it validates it as well. With that video, next slide, please. You could, I forgot, my apologies. I got ahead of myself, but you also, with today's environment of COVID-19, a lot of institutions are doing their debriefing from home, having their learners go home and debrief because, again, trying to keep large groups of people coming together. Or you could even run a scenario as an instructor or an educator and have your learners logged in from home and interacting with the scenario as it's unfolding. You know, hey, the heart rate's dropping. How should we act? What should I do next? Hey, I just gave this drug. What should we do next? And that way it helps their communication skills because they're giving you verbal cues, as well as it still allows you to do hands-on simulation or within the sim lab during these times of social distancing. Next slide. Another part of that is it can also be telemedicine. Telemedicine is built within the application. So rather than doing an encounter with a high fidelity mannequin or the virtual reality, you can have an actor or actress on one side of the screen and then the student on the other side of the screen, and they can go through a case or scenario. And then you, the educators, the true experts, can watch that just like the regular simulation, do an evaluation and provide feedback and assessment. Next slide, please. So whether it's a telemedicine case, whether it's a in-person, whether it's virtual reality, you can record all of those and then bring them into our system and do checklists and evaluations to track how are they performing with the simulations, and you can tie those to your core competencies. Next slide, please.
And you have about 3 minutes left.
Yep, I have a running timer, so I'm going to have to kind of go through these pretty quick. We had some out-of-the-box AV options for you. That are good for starting points if you just get your feet wet, and then we also can assign an engineer to your program if you need something a little bit more robust. We have a full AV engineering team on staff, but this is our one room, which comes with a couple cameras, overhead paging speaker for voice of God or hospital announcements, as well as pillow speakers to talk through as if you're the patient, and microphones. Next slide, please. You can go. That's just an example of that fully installed. Next slide. And then, as you can see, we also have portable options for inside two training. Perhaps you don't have dedicated space, or perhaps you want to do training in the actual OR, the real OR, the real ICU. You can use a product like this, which is also web-based and can connect wirelessly to that laptop. Next slide. We have another product or you could skip this actually because I'm taking a little bit longer than I thought. We also have another product as well for true mobility. The other product's great if you want to wheel IV poles around your building. This product is even more mobile. You can put everything into a Pelican case or backpack, and again, they connect wirelessly to that laptop, and you can stream that anywhere. Next slide. Here's an example of that mobile being used in a baby warmer situation. You can get pretty creative if you don't want us to do the hardwired cameras in the ceilings. You could also do something like this, where if you notice on the picture on the right, they have a camera in the baby warmer and then another camera on the head wall. And then you could be in the room next door watching the simulation unfolding and controlling the mannequin. And there's two benefits of that. For one, it takes you out of the room, so they're not constantly looking over their shoulder to see verbal cues if they're doing well or not. And for two, it takes the educator out of view, because a lot of times we hear the educator will jump in and stop a learner from doing something, making the mistake that they can learn from. And this is the time to make mistakes, is in the simulation program. Next slide. So this is just an example of from that laptop or from wherever of how you would see the vital signs, the mannequin. Next slide. It's very intuitive, very easy to use. That's a control. You could even capture stuff just from the phone or tablet, which is true mobility. So you have the ability, we have a lot of apps for our Android and Apple users where you can film it just from a simple iPhone and upload it and then do a checklist and evaluation if you want. Next slide. And then this is just a video of that app in use. But we only have about 30 seconds left, so that's about it. I'm gonna leave this slide up for the questions. If you could just scroll through all the bullet points. I think you have to just do it one by one. My apologies for that. But as I mentioned, I tried to show you as much as I could to pique your interest and show how we are helping institutions all over California and all over the world today. And if you wanted any more information, feel free to reach out to us, simulationiq.com. We'd be happy to do any type of demos or learn more about your program. Questions?
All right, at this time, we have opened the Q&A panel for questions. for Mr. Gillespie. And for board members, if you have a question, you can either type it into the chat or raise your hands. For members of the public, you can use the Q&A field and type your question directly into the text box.
And if somebody, it seems like a reoccurring question, how much does it cost? Our solutions cost at about $10,000. And then there's a wide range after that.
Okay, the first question, what are some areas that your organization has identified as challenges or limitations for programs after purchasing this software?
It depends on the actual product, because we have some pretty robust management software. And, you know, we have very basic, simple, people getting their feet wet with simulation, or they just want to record, debrief. That's very simple, easy to use. However, we also have, you know, a very robust management software piece at the end where you can do integrated reliability reports, competency tracking and reporting. So typically, it depending on the solution, we could spend up to 3 days training with the client success manager coming on site and helping you train. So that's one thing that we really, everybody's so busy that sometimes, you know, they don't want to spend all that time training, but it can be if you wanted a robust system. So getting our clients to sit down with us for a couple of days can sometimes be a challenge. Another challenge can be, you know, we can provide everything turnkey in terms of the cameras, microphones, and software. Every once in a while, the institution might have an existing relationship with an AV company. And most times that works fine. They can provide the cameras and microphones. We're the management software people. But, you know, what happens when the cameras don't communicate to the software? Sometimes our clients get stuck in the middle of that. You know, it's the software's fault. No, it's the camera's fault. And then they're trying to manage that. And like I said, most times it's fine, but every once in a while we run into that as well. I've been with the company now for 10 years. So those are the two main things I can think of. But honestly, I think we have it down pretty good.
Okay, and next question, wanted to clarify that this program integrates with all other programs for simulations.
It integrates with all the major mannequin manufacturers. It can integrate if you're a school with Blackboard, Moodle, Canvas, whatever your LMS might be. We're a Microsoft company, so it can integrate with Outlook, Excel, Word, you know, whatever else it might be. So I'm not sure. Integrations, it's a very, the term can mean a lot of different things to a lot of different people. So I'm not exactly sure what specific platform you're talking about, but I'd be happy to do a one-on-one, or if you wanted to put it in the chat now.
Okay, and last question, as we are just about out of time for questions on this one. How often does the software need to be updated, and are software updates complimentary with purchase?
Yeah, so the software typically updates twice a year because a lot of our clients are schools. So we typically do it around winter break and summer break, which is also a good time for hospitals as well, because a lot of people might not be doing as much training around the holidays or in the middle of July. But we update it twice a year. And as long as you're on the we give you complimentary service plan for the first year, 365 days, which includes as much training as you want. It includes all hardware replacement and everything else. If you're on that support plan, you get the software upgrades at all times. Moving forward, year 2, you would have to be on the plan, which we have multiple levels. We have silver all the way up to platinum, which have different features and functionality, but they all include software upgrades. That's the one thing we want to make sure all of our clients have is the software upgrades.
All right, and it looks like that's it for questions at this time. Thank you very much, Mr. Gillespie, for your presentation. We are now going to be taking a 10-minute break, and we will be returning at 10:45 for our next presenter.
Thank you, everybody.
All right, it is 10:45 and we are back, and we will move on to our next presentation from Swift River, and presenters are Chloe Suffrage and Dan Moreshi. As well as a presentation from the Department of State Hospitals, Atascadero Cuesta College by Lindsay Byers. And we'll be beginning with Swift River.
Hello, everybody. Good morning. I'm Danny Moreski from Swift River. I am a registered nurse and, excuse me, and also the founder and creator of the virtual hospital that we call Swift River. I have a very difficult task now in that they told me I only have 3 minutes to make an introduction, so bear with me here. I am going to tell you that we are 100% clinical decision practice. We have 540 patients and 12 simulations. And what makes us unique in our virtual simulation products is that we are in real time in the presence of call light distraction, and students can practice with multiple patients at one time. So we are also available 24/7, and we're always growing and expanding. I actually taught mental health nursing in a BSN program and also in a practical nursing program. I felt there was a real need to teach the management of stress and to provide students with tools so that they could de-escalate a patient who was at a higher level stress. So I'm going to talk for the next minute and a half on our mental health simulator. And let me say that we have mental health patients, that are in community health and med-surg and in med-pass, where we're giving meds to multiple patients, and et cetera. So mental health is throughout all of our 540 patients. But one of the SIMs in particular is our mental health SIM, and that's in 5 phases. It works very simply. The first phase, the student sees a series of patients, or a series of definitions and terms, and they have to match those. In the second phase, it's a snapshot in time. They see a patient and they have to associate a diagnosis. In the third phase, they have to associate a psychotropic medication with that diagnosis. Fourth phase, side effects with that psychotropic medication. And in the fifth and final phase, which happens to be my favorite, they go into the day room and they see a multitude of patients, usually 8 to 10 we recommend, and they hover the mouse over the patient and they have to identify which patient has the highest level stress. And that's ranked between normal, mild, severe, and panic. And so they need to identify the highest level first and learn how to sequentially think. And not only do they identify the patient, they have to also select one of 5 interventions to do. And I can tell you, while I taught psych for 6.5 years, I also worked evenings as the charge person in an acute care psych unit, double locked. They were all either homicidal or suicidal patients. And I would bring my students during the day there, and I was the charge nurse in the evening. And what I found during that time is our psych techs were our strongest assets on the floor. And that most nurses, sorry to say, would hide behind the nurses' station. And they'd leave all the intervention and the assessment largely to the psych tech. So I have tremendous respect for psych techs. And I also feel that nursing students are woefully ill-prepared to enter mental health situations. They virtually had no training. And when I was teaching this, I researched and tried to find a product that would teach stress and teach intervention, and there really was nothing available. I think Swift River is the only product out there that teaches this. So this was birthed out of real need. And I have to tell you, I started this for my class. I created it for my class. I had no plans to take it anywhere else. Well, word of mouth spread, and I was in probably about 50 schools after a couple years of use. And then COVID hit, and now we're coast to coast. We have over 200,000 students using us from coast to coast, and we're growing every day. So I think we're on to something. It is virtual simulation. It is done in real time. It's available 24/7. We're very low fidelity. We're very user friendly. And we're always creating opportunities for students to get clinical reasoning and clinical decision practice. And we're told that the next gen NCLEX is going to be asking the same kinds of clinical decision questions and clinical reasoning questions that we ask on Swift River. So I think I took my 3 minutes. I think we've got a video, and then we're also going to have somebody address you about our developmentally disabled sim. That's not, we need to see, that's it. Thank you. Health is fun. I'm not hearing any sound.
So you're not hearing anything from the video at your end?
No sound at all. I would start it from the beginning.
Yeah, I can hear it at my end. I'm not sure
Okay,
why.
all right. Well, I don't need to hear it. I was actually presenting it. If everybody else can hear it, that's fine.
I'm not sure.
This is the other moderator. Unfortunately, I cannot hear the video. Is it possible that Dan can talk us through the video while it plays?
Sure, I'd be happy to do that.
Thank you.
You start it from the beginning. Okay, good morning, everybody again. We have a video with no sound, so I'm going to talk you through it. This is our Swift River mental health program, and the very first slide that you're seeing here is you get to select whether you want a quiz mode or practice mode. In phase 1, you've got a very simple definition. The patient's observed posturing and staying in the same position for extended periods of time, flat affect, echolalia, and waxy flexibility. You just have to select the term. So from the drop down, that would be catatonia. And you're told immediately with every answer you're right or wrong. Now, this one's disrespectful for lawful behaviors, repeated lying, interested in only pleasing yourself first, no guilt or remorse. And that would be antisocial pattern of behavior. And you're told that is correct. The next definition, anxiety so intense it causes a person to fear death, fear more episodes, be afraid of crowds or open spaces, lasting for a month or more. And that would be panic disorder and agoraphobia. So now phase 2, snapshot in time, you get a patient and you have to associate a diagnosis. This is a patient, Lena Smith, observed in an awkward pose. She's been in the same position for several hours, not responding to verbal commands. The patient's not responding to any verbal stimuli, and she has waxy flexibility. Her arm is up and is moving. So that would be an example of catatonia. And you're told you're correct. And now phase 3 goes to what medication would you expect Lena to be on of those 4? And actually, I'm going to say nortriptyline, Pamelor, would be the second one down. I think I can't quite see it on the screen here, but I believe that's right. So you're learning to associate a psychotropic med with a diagnosis, just exposing it. And we know the side effects are major. And this one was incorrect. Somebody picked the wrong one. And I was right, it was nortriptyline, and it gives you the rationale. Now, phase 4, what are some concerns in giving nortriptyline? And I'll tell you, having worked as a charge nurse in this and having students, the side effects are major with psychotropic drugs, so they need to be aware. So you would need to pick 2 that would apply here. And I would say, I can hardly see the screen. I would say the second one and the third one would be correct. You'll see this in just a second. So phase 4 is about the psychotropic meds, and you see that sunlight, and we've got one of them right and one of them wrong. And again, there are 43 mental health patients. Now here is phase 5, and this is my favorite. You're now going to go into the day room and identify stress between mild, moderate, severe, and panic. And you have 5 or 6 interventions. You and I know there may be 100 interventions, but we want to help our students associate right off the top of their head to be able to respond quickly. Practicing nursing safely involves time. You can't wait too long to make a decision, especially in mental health. So we have our 4 levels of stress. They need to identify those and the interventions. So now we're going to go into the day room, and you'll see a group of patients that are there. In just a second, here it comes. So there's 3 patients in the day room, and you have to identify who is the highest level stress. And for a student scenario, we would have 8 to 10. So the first one, Sally McPherson, she's at the highest level, her gross motor skills, throwing objects. The second one, Tom Richards, he's threatening others. And then the third one, she's eating dinner and asking about a dental appointment. So you've got 3 patients, all different levels of stress, and you have to identify. So the gross motor skills at the highest level, that's a full-blown panic. That would be Sally McPherson. And you're told immediately that's correct. And now what intervention are you going to do? In this drop down, there'll be 5 or 6 interventions, and there's only one that's correct. And so we're going to look and we're going to say, I would say assess for, or we're going to look it up. So we're going to go to panic and we're going to see of our choices, assess potential injury for self and others. Call for therapeutic team support. That's a good one. Call physician for on-site assessment, but only one is right. And then the last one too was conduct debriefings. And we know in a panic, you're going to conduct debriefings. Or call MD and administer. That's really not correct. It was to assess injury to self and others first. That's your first action. So this is how we learn stress and how to intervene. And I don't know of any other tool in the world that teaches your students how to think on their feet rapidly and in real time and in distraction with multiple patients. Now, Tom Richards is threatening and pressured speech, so he would be severe. Lena is eating dinner, so she'd be normal. If I pick Lena, it tells me I got her right, but I didn't pick Tom Richards, who had a higher level stress. So you've got to sequentially choose the highest stress and then down to the lowest. So it will let you play her, but knowing that she wasn't your best choice. And here you're going to employ empathy and communication would be the correct choice. And that is correct. And the last one, Tom Richards, he's got pressured speech, threatening others. That would be severe. And that tells you you're correct. And then with severe, you would then, let's see, empathy, help patient focus on here and now. I'm going to have him maybe focus on here and now, and we'll see if we got that right. Kind of late just to employ empathy. And a cool beverage would be in moderate stress. And so we put limit setting in for him. So then we get a score in 7 minutes and 10 seconds. This is great to do with your psych tech students and PN students. Put them together in teams of 2 and have them compete for the best time and the best score. And they should have 8 to 10 patients in each scenario. And for additional mental health practice, you're going to hear shortly about our developmentally disabled. And also we have a myriad of other patients that you can look up in our patient log and find them in community health and all. So we're very proud to offer some real clinical decision practice, clinical reasoning practice in mental health for your students here with Swift River. I'm happy to do a private demo with anybody that would like that. You can access me, dan@swiftriveronline.com, or you can also contact us through NurseThink. Thank you very much for this opportunity.
Thank you, Dan. And if Lindsay Byers is ready, we can move on to her half of the presentation.
Thank you.
Hi, everybody. I'm Lindsay Byers. I'm the program director for the Psych Tech program through Department of State Hospitals Atascadero and Cuesta College. We have a unique partnership, and so I do like to say the full title. I've been asked this morning to basically give testimonial and just my experience of utilizing Swift River. As you all experienced in March, we went through a state of shock when our clinical sites were unable to allow our students to come in and perform their clinical hours, the required clinical hours. And so as the Psych Tech program statewide, there are 12 of us, got together. We were brainstorming what we could do, how we could get our students to learn and perform their clinical objectives, even not in the clinical setting. And I really do respect the board's position that they were very strict and stern on maintaining that no more than 50%. I did hear a lot of programs wanting to, well, let's go to the Capitol and let's try to increase that. We're in the state of emergency. But I do firmly believe that there is, like we heard in the earlier presentation, there is a confidence, a skill set, a different learning environment and opportunity when they're in the real setting. So I was very cautious and conscientious when we were trying to brainstorm and figure out what we could do for our students as a supplement for them while they could not go into the clinical settings. Swift River has been a long partnership with us as psych tech programs because Dan was very promoting of the psych platform. We've had Swift River come to our CAPTE conferences and promote what they have to offer. And since then, they have increased their med-surg, their nursing fundamental, their psych, and then as psych tech programs, as you guys all know, we are have a developmental disabilities component. And just to give you a little bit of history, the state of California has really struggled to provide the developmental disabilities clinical site because we were so reliant on developmental centers that the state had supported and had initiated. With those going away, it became a lot more challenging for our programs to meet those clinical objectives, to get our students out into those clinical experiences. I'm happy to say on the Central Coast, we have amazing day programs and special ed programs, so we have been able to continue to thrive and function and get our students exposed to that. But when the crisis hit, a lot of those doors, of course, were being closed. And so Dan and I got together, we worked, made Saturday phone calls, working together on what kind of product they could provide, what kind of product they could help us out with. So as psych tech programs, we got together and we had just splintered off how to break it down to get those objectives met again when we needed that supplemental learning. And so very similar to what he showed you in the mental health platform, you will, in their DD platform, you see developmental disability clients having some type of behavior or having some type of medical emergency, and the student then needs to identify which one the work in progress. We've only got 3 different diagnoses in that platform at this time, but we have the appropriate medications, so they're able to identify what medications would be best, what side effects, and what patient teaching would they need to do. It has been very helpful and beneficial to our students because it is in alignment with the theory content that they're learning. So they're learning the terms, they're learning to identify the behaviors, they're learning to identify the intervention. They continue to objectives. It keeps their mind going on those
just a couple minutes left.
Experience that that licensure exam and then of course be confident
due to some
text. So
connectivity
it has been together and identify what would be the pertinent.
I don't know what happened to Lindsay here, but I'm sorry we lost Lindsay here, but we have about 70 patients in there that are developmentally disabled for students to practice their stress levels and intervention and administering meds and all of the same components. What's unique is this is really, I think, the first time this population has ever been addressed in any form of simulation. I can tell you in my 49 years of nursing and trying to look for something for this population, it was very difficult to find anything. So we had to create our own. I've lost sound, or can you all hear me? Lindsay, can you hear me?
This meeting is being recorded.
One.
This is the moderator. Looks like there were some technical issues with WebEx. It seems like my connection temporarily dropped, but Dan, we were able to hear you when you were talking. I think when I responded trying to tell you that, my connection dropped.
Okay, great.
My apologies.
Can you hear me now?
We can,
Yes, we
and
can hear you.
unfortunately, yes, and we are out of time for this presentation right now, so we're going to move on to our next presentation.
Okay.
We are going to leave the question and answer channels open for individuals to submit their questions, and then we will capture those, and program staff can reach out back and forth to you to get those questions answered and responded to in writing after today's presentations.
Okay, so it will not happen today necessarily. Right. Okay. All right. Well, thank you very much. I appreciate the opportunity.
Thank you.
Thank you, Lindsay.
All right, so our next presentation again is from Elsevier and Shadow Health. And presenting will be Ashley Nagel, Karen Pasimo, and Jennifer Broaders.
One moment while I get them all promoted.
Good morning, everyone. How are you doing today? Thank you so much for having us. My name is Ashley Nagel, and I am one of Elsevier's education consultants for the West Coast. With me today, I have Karen Pacimo, who is my digital expert, and she will be presenting on the simulation learning system. And then I also have Jennifer Broaders, who is one of the regional managers for Shadow Health. Just a quick shout out. In addition to our simulation learning system, we did just come out with our simulation learning system with virtual reality. We currently have it for our RN programs, but LVN is coming soon. So I just want to make you aware of that, and we'll be happy to send out a video afterwards of what that will look like. But please go ahead and you can start the video that Karen prepared demonstrating our simulation learning system, otherwise known as SLS.
Hi everyone, thank you for taking the time today to learn more about Elsevier's Simulation Learning System, or SLS. SLS includes all the content and information that schools need to successfully run lab scenarios across the entire LVN curriculum. During this presentation, we'll show you how SLS can help students in a variety of ways, including improving their clinical judgment and clinical decision-making skills. So why simulations? Well, last year, COVID proved schools needed an alternative solution when they were no longer able to access clinical science. Also, the NCSBN has a study that demonstrates that high-quality simulation experiences can be substituted for up to 50% of traditional clinical hours across the nursing curriculum. And then there's the 4 C's. The first C is confidence. It gives exposure to emergency patient situations that students may not see in a clinical setting, such as MIs or pulmonary embolisms. Number 2 is clinical judgment. It allows them to be exposed to clinical situations where the simulated patients will present assessment findings that should cue students to recognize a call for action. 3 is confidence, the ability to be involved in their own learning. Students receive a guided preparation, pre-work, and they have the opportunity to be involved in a facilitated debriefing where they can reflect on their own performance and or that of their peers and determine ways in which they can improve in the future. And then the final C is communication, improving those soft skills. Hospital administrators have reported that students are weak in soft skills, and only about 20% of employers are happy with recent graduates' decision-making skills. Through simulations, students can practice those skills, therapeutic communication, documentation, delegation, and prioritization. They also are able to practice interprofessional communication and gain an understanding of how the various health professions work together to care for a patient. So what else is going on? Well, we know there's a shortage in clinical sites, and the competition for those sites gets stronger every day, and SLS can help with that. There's also a lack of control. Every student is not seeing the same clinical patient. They're not getting that same experience. And with SLS, not only can they get the same clinical experience, the faculty can easily evaluate the students on the same clinical experience. High-risk patients. Novice students are often asked to leave a patient's room during high-risk situations, and SLS allows them to practice responding to those types of scenarios without incurring risk to real-life patients. And then finally, but importantly, the changes are coming to the NCLEX exam. Simulations are a great way to help students develop their clinical judgment and clinical reasoning skills without putting a patient at risk. So, simulation learning system covers fundamentals, med-surg, mental health, peds, and maternity scenarios. Each scenario is standardized and presented in 3 stages. Pre-simulation or preparation stage, the scenario itself, and the post-simulation or debriefing stage. Pre-simulation for the faculty include a facilitator's packet, which is going to help them every step of the way from start to finish. There are pre-simulation quizzes and exercises for students. And for the scenario itself, there are algorithm quick cards for the faculty to help them every step of the way. Afterwards, there's post-simulation assignments and quizzes for students, and then there's the all-important debriefing process where most of the learning occurs. So let's go ahead and take a look. So for the students, we have broken it all out for faculty where they can just assign the reading assignment, the pre-simulation exercises, and the pre-simulation quiz. They can also choose to make available the skills that the students need to be proficient in to perform in that scenario. Because you want students thinking and concentrating on patient care, not how to drop an NG tube. This allows them to make sure that they feel comfortable with these skills, if not, the opportunity to remediate before the scenario. Then for the faculty, we can see that the scenarios are set up in that pre-simulation, simulation, and post-simulation. There's a facilitator packet for each scenario that will walk the students, faculty through exactly what they need to do to run that scenario. So here's the purpose, the overview, how long it should take them to run through the simulation, and how long we recommend for debriefing time. Again, we have the skills listed out and the staging instructions. So your lab coordinator, whoever it is, can make sure that all of the props and equipment that are needed are there, including a computer by the bedside. There is an EHR, which is complete with the patient's admission history, their MAR, and any documentation that was done prior to the students coming on to take care of that patient. There's also staging instructions on how to position the mannequin and wristbands for the patient, and in this case, his guardian or his mom. We also have the patient SBAR handoff so that faculty can give the student information on that patient, on the background information. Again, the last set of vitals, they can go in and look this up on the EHR and they can add to it. We also have patient responses. So whoever is assigned to play Johnny, if the nurse asks them a question, they will know how to respond. There's also a response guide for his mom. So any questions that are asked of her, she knows what to respond. And in this case, there's also a live specialist that would be assigned a role. And then here are the role badges, so everyone knows who everyone is during the simulation. And then for those students who aren't actively participating in the sim, we provided an evaluation rubric so they can show exemplars during the scenario that their classmates did in areas for improvement, things they did well, and we give them lots of detail and information on how to fill this out. We also have a scenario snapshot. So what is going on in each scenario, the situation, and what the expected student performance is in that each phase. And then we have the algorithm quick card. Again, so real quickly, the faculty can look if the students are doing what they should be doing. This is how it should flow all the way through to the debriefing. And then the last piece is the performance checklist. So the faculty can evaluate, take notes of the students moving through the performance. Again, that will be used in the debriefing. So now we get to the last part, and here's the debriefing procedure. We'll walk the faculty through how to set up the debriefing, even give them some reflection questions, guided questions on nursing diagnosis, patient teaching, growth and development, culture and diversity, and walk them through everything that they need to do. Anyone, even if they've never run a simulation before, can take this and run a great simulation. And then to tie it up on the student's end, we have post-simulation exercises and post-simulation quizzes, and there's even a place for them to journal about their experience. So I hope this gives you a good overview of SLS, and we'll be able to answer any questions that you have or anything else that you need. So once again, appreciate your time and look forward to hearing from you. Stay well.
Excellent. And then up next is Jennifer Broaders, who's going to present on shadow health. So we start with her PowerPoint.
Hi, everyone. Thank you, Ashley. I greatly appreciate you guys allowing us to come in and share our suite of products that Shadow Health and Elsevier offers. I'd like to speak a little bit to the Shadow Health virtual simulation and share the suite of products that our product line offers, highlight some of the key features, and then share a short demonstration just to give a taste of how our product works and how students would go about interacting with our virtual patients. So if you could skip to the next slide, please. Or does this actually let me? Oh, there we go. Perfect. So I'm going to start, like I mentioned, with talking about our suite of products, the features, and then the demonstration. So as far as what Shadow Health is, we are a screen-based simulation. It's an online learning platform that students can access anytime, anywhere, as long as they have a reliable internet connection and access to a Mac or Windows-based computer. We currently offer the 7 product offerings that you see on my screen: health assessment, pharmacology, gerontology, mental health, leadership, pediatrics, and maternal health. This is a typo on there. I apologize. And we actually will be adding fundamentals and community health this fall. So as far as when we were speaking to faculty to try and get a sense of what they were looking for in a virtual simulation, some things that faculty shared with us was that they would like to have a way to measure students' clinical reasoning, have more insight into students' performance, and even potential clinical hour replacement, which our program lends itself beautifully to help offset clinical hours. What faculty were looking for students was really just a safe environment to practice, to hone those communication skills that are so vital for nursing students, to be able to practice how to assess a patient and can they accurately interpret those physical exam findings through that assessment process. How do I overall organize my interview to collect the most relevant information, and just being able to really hone those critical thinking and clinical reasoning skills that are so vital for nursing students today. So what makes our program unique versus any other virtual simulation on the market is that Shadow Health has a patented conversation engine. And what this does is allows your students to communicate using very natural language with our virtual patients. So instead of it being a pick list or a drop-down menu where students can only select from pre-listed questions, and then based on that point and click option, it would populate another list of questions for them to choose from where they can just click their way through. Students actually have to engage their critical thinking skills to figure out, how do I start interviewing a patient? How do I ask relevant follow-up questions? When would it be appropriate for me to offer empathy or education? So the students are driving the bus, so to speak, thinking through this process. And as they are, we are actually able to measure their clinical reasoning. We have developed a rubric. It's called our Student Performance Index. And what our Student Performance Index is doing is measuring your students' clinical reasoning in several different areas of assessment. and then comparing them to similar level students across the country working in that same shadow health assignment. So you guys would be able to see how your students are critically thinking through working with, let's say, a patient who comes in with bipolar disorder. What would be the need to know findings that I would need to uncover? Versus if I was working with a geriatric patient who's presenting for an end of life type scenario, what would I need to uncover with that patient? So when we say we measure clinical reasoning, it's within the context of each patient case based on what those need to know findings are. This here will give you a quick glimpse of what our health assessment product offers. I'm more than happy to include assignment overviews for all of our products. I just did initially for health assessment since we have limited time today. But basically, once students gain access to any one of our products, let's say a school decided to use health assessment, students do maintain access to any license they purchase for a one-time cost from the time they purchase access until they graduate from the program. So for our health assessment product, to just give you a sense of the types of assignments that are included in it, it will be broken down by single systems. So when students are learning that head-to-toe system by system assessment, students would get to practice on our virtual patient, Tina. So she is coming into the hospital. She is presenting with a painful foot wound. Tina has asthma. Tina has diabetes. So it allows students to go in and explore her health history in depth. And then they get to explore her systems, each individual one, as faculty are covering those different systems throughout the course of the semester. There's also some focused exams where students get to practice with additional types of patient that span the lifespan, offer different ethnicities, different age groups. But essentially, our patients are able to answer hundreds of thousands of questions. And again, it is speech to text. So it really allows students to start honing those communication skills, getting that valuable practice with patients, especially with the challenges that a lot of students face today with basic communication skills. So our program will help set them up for success to be better prepared to interact with real life patients after having the opportunity to work with our patients in our safe simulated environment. So I'll go ahead and let you guys get a glimpse of a short demonstration. And again, if anyone beyond this meeting would be interested in taking a closer look at any one of our additional products, I would be more than happy to set up a separate demonstration to go more into depth on the others. Are you able to have the audio work? Is there no way to get the audio to work?
Hi, this is the moderator. Unfortunately, it seems we are having an issue with the audio. Not sure how to fix that at this moment.
Is there some kind of like permission that you have to?
This is the moderator. Also sounds like our presenter has lost audio. That might be why we're not having any audio from the video. Shelley, unfortunately, I cannot hear you.
Can you hear me now?
Yes, we can hear you. Thank you.
That was so weird. Okay, so yeah, we're having some technical issues with WebEx today in getting any audio to feed through for presentations that we're running outside of WebEx. So unfortunately, there's not a whole lot we can do about that. We were advised to stand by. The board executive officer did indicate that they are planning to post all of the presentations or links afterwards. So it might be something that people can go back and watch after the meeting. So if you want to just go ahead and finish with any remarks you have, we have about 3 minutes left. And then we have 5 minutes after that for Q&A. So I'll let you wrap up and then let me know when you're ready for questions and answers.
Okay. Again, we are going to be the only virtual platform that allows that free-flowing conversation component of the interview and interaction to happen. And so within each of our different scenarios, let's just say we are talking with a mental health patient coming in with PTSD, it would be up to me as a student to figure out how to ask questions, how to frame my questions, how to ask appropriate follow-up questions based on how the patient responds. Can I recognize moments when I should offer empathy or education? And so it really does provide that opportunity for students to really improve on those critical thinking skills that are so vital. And as well, you were able to meet the students where they are in terms of setting expectations. So we do have different features within our product as well that you can provide assistance to students earlier on when they're learning. So if they need more assistance through that subjective data gathering process, you can provide it. And then as they start to progress throughout the curriculum and you want to start dialing back some of that assistance, you can start to take it away and allow yourselves to see how the students are able to think on their feet without the guide. So again, our conversation piece is going to be what's unique to Shadow Health versus it being that pick list or drop down menu. Students do get to examine all of our patients in our virtual environment, and they do have to assess those physical exam findings, and they have the capability to document those findings. And then they're getting measured on that education and empathy component as well, just so that way you can see if they're able to pick up on those moments when they should offer empathy or education. And again, as a result, you will have a rubric provided for each different student that will allow you to see how they are measuring in terms of their clinical reasoning proficiency level for all of the different cases that they are working through. We can provide accreditation mapping, so we've mapped all of our products to the different accrediting bodies. I'm happy to share a white paper on how you can use our product to help offset clinical hours. And if you guys have any questions, you can let me know. But my apologies that the demonstration wasn't able to play because it's extremely savvy and impressive. So I hope you guys take the time after the meeting today to go back and watch it.
All right, we will open up for questions. Again, members of the board, if you'd like to ask any questions, you can raise your hand or type your question into the chat field. For members of the public, you can write your questions into the question and answer field on the Q&A panel, which you can access through the Q&A icon on your screen. And we have about 4 minutes left for questions. One question is, how long is the average simulation experience?
For which product? For the simulation learning system or the shadow health?
That is a good question. While I wait for clarification, we'll move on to the next question. What is the average time for the students using shadow health, and how often can the student access each scenario?
Each of our simulations on average takes about an hour and a half. Students can access it as many times as they would like, depending on how faculty set up that particular course. So faculty can decide. We actually provide instructional design support when schools are interested in moving forward with our product, where our course designers will help you develop the best integration plan specific for your curriculum. So depending on what the goals of the faculty are, whether it be mastery learning or clinical reasoning check, whether they want students to have repeated attempts to go through it or to be more summative or more formative, you get to control all of that. So if you want students to work through it once, you can set it up that way. If you want them to work through it until they achieve your level of expectation, you can set it up that way as well. So there's a lot of flexibility with that.
Okay, and do you have a rubric for the measurement of clinical reasoning, or does faculty perform this?
We provide that rubric. So every single case has different parameters that we are measuring the students against, and both faculty and students will be able to see how well students perform compared to that rubric once they submit their assignment.
Okay, and next question, how often are you planning to offer new patients?
The market dictates a lot of that. So we have our 7 product offerings now, and like I mentioned, we will be adding fundamentals this fall, which will lend itself nicely for the types of curriculum products that you guys are looking for.
And does the evaluation help the student and faculty direct the student learning?
Absolutely. You will have full transparency into everything your students are doing. Everything that they do well on, they get feedback on that. Areas that they need to improve upon, we provide examples, we provide rationale, just so that students are fully aware of why they need to be doing all the different things that the program is measuring and expecting them to do.
Does the evaluation of the student identify if they have achieved or improved clinical reasoning and communication skills?
You will actually be able to see over the course of the term how their proficiency level is improving, if it's moving from beginning to developing to proficient. And then you will also be able to track how your class is averaging as well in terms of the different metrics that we measure. So we have a lot of different data points for faculty to track that make it very easy to see how their students are trending and then bring to light those students who may need additional attention before it's too late or at the end of the semester.
All right, and tech support is important. When is tech support available?
Our hours are 7 days a week. Monday through Friday, it's 9 a.m. Eastern to 9 p.m. Eastern. And then both Saturdays and Sundays, it's from 12 p.m. to 8 p.m. Eastern.
And with Elsevier, our tech support is 7 days a week from 12 a.m. Central Standard Time to 6 a.m. Central Standard Time. I'm like 6 a.m. Central Standard Time to 12 a.m. Central Standard Time.
All right, and it looks like that's the end of our Q&A time. Again, any additional questions that have been submitted that we didn't get to, we will answer offline after the meeting. At this point, we're going to move on to our next presentation that is scheduled to begin at 11:45. And that will be presentations by Sandra Miller and Ashley Allen of ATI.
Good morning, everybody. Almost afternoon. Thank you for sticking with us. I think we're the last presenters today. You're joined by myself, who is the Regional Vice President for Solutions for the West, Catherine Meglich, who is our nurse educator and provides solutions support to the faculty in the West, and Ashley Allen, who is the Regional Director for the West. So we're going to go right ahead and begin the presentation. Do I have controls?
Sandra, you want control of the PowerPoint?
Or you can go.
Okay, either way is fine. Okay.
Well, we've already done number 1, so let's go next. Catherine, do you want to start?
Apologies.
Can you unmute Catherine Meglich?
I'm getting her promoted. One moment.
And I think Ashley Allen's having trouble seeing and hearing.
Sandra, can you hear me?
Yes, perfect.
Yeah. Okay. So you can hear me and you can see me. That's good. As Sandra mentioned, I'm the nurse educator that works with the West sales region. And like many of you, I have taught at 7 different colleges and universities along the West Coast, Washington, Oregon, California, and then also was a director at a couple of those. So I always feel at home when I'm presenting in front of my home people. In addition, I've been at ATI for about 18 years now and started our NCLEX preparation solutions and was in that department for about 12 years and then moved over to this position. And it looks like Ashley just rejoined us. She and I often have internet issues, but we are determined.
We are.
So Ashley, do you want to start?
Sure, absolutely. I'll quickly introduce myself. My name is Ashley Allen. I am the West Regional Director for ATI. I have been with ATI for a little over 10 years now and have been lucky enough to work with nursing programs in California for a little over 8 of those years. So we're excited to be here today. I'm going to start by really just going over some of the common threads that you're going to find within ATI's resources, specifically our simulation. Something that I think is really important to point out today is what we're going to talk about today is specific to a vocational nursing program. That's very important here. As with some simulations, you might see a crossover with scope of practice running into that of an RN program. So we'll make sure and be very distinctive about that as we present today. So something that you'll find within ATI is that the simulations are going to provide over 400 hours of clinical replacement. So that's going to be across all content areas, whether we're talking about medical, surgical, mental health, maternal, newborn, etc. So we'll get into some of those details today, but that breakout of those hours is really important here, especially given the circumstances our programs have been in the last many months with the pandemic. Some other things that are important to point out here. All of our simulations are going to include lesson plans. So they're also going to include clinical lesson plans that will actually outline and show, okay, how many hours of this can be designated towards clinical replacement? How many hours is going to be required for student preparation, for pre-briefing, for debriefing, etc. So we want to make sure that our resources are going to provide that really great foundation, not just for the student, but for the educator to really be able to take these and run with them and use them, whether it's in a virtual setting in a Zoom classroom or even in person when that is possible. Some other important factors here that you're going to find with ATI is that we use both medical grade actors and virtual humans. It's important to note that this is a distinction within ATI, because what we found is that we needed to be able to support the different levels of comfort that your students are at and really meet them where they are. So you'll see that with some of our simulations, you'll see medical grade actors. With others, you'll see virtual humans for that reason. There's also a real focus here on simulation that's going to require the application of the next gen action model. That's something Catherine's going to talk about here in a little bit. So I'll have her, she'll go in more into that in depth here in a bit. And then finally, we want to make sure that emotional and practice fidelity within our simulations is really going to reflect a real life experience, because at the end of the day, with the simulation, what we're really trying to do is we're trying to create practice ready nurses that can go out there and feel comfortable thinking on their feet, feel comfortable in those tough situations where maybe they're not sure what to do, but they can really use that foundation of what they've learned in their time with you to get a really strong head start. Okay, so something that's the center of all of ATI's resources and are really central with our simulations as well is what we call our learning loop. This learning loop really starts with learning, moves into testing, improving, and then finally we have application. So you'll find a lot of our simulations will really focus in on that application, but we don't just want a student to go blindly into a simulation. It's so important that the proper foundation has been set and that they have the proper learning and preparation so they can really be successful in that simulation and really play up what they know and also identify the things that they don't so they can continue to grow as a nursing student and then ultimately as a nurse.
Ashley, unfortunately, we lost your audio. We could not hear the last part of what you were saying there.
I think while she's trying to regain her audio, what she was trying to make with the learning loop is that we want students to have a foundation before they actually go in and practice simulation. So within our learning loop, there are opportunities for them to learn content and then to test that content and improve upon what has been identified as a weakness for them, and then to apply what they've learned within simulation. And let's see. Ashley, are you back?
Can you hear me?
I'll just keep going.
Yeah, keep going.
So Skills Modules 3.0 is with EHR Tutor and virtual simulations are a way for students through 30 modules to learn 180 skills. And so this is also set up where students are going to learn about the skill that they're performing. Evidence-based practice present. And then there are checklists, actual demonstrations on live actors with real anatomy, so that the nurse is handling the insertion of, let's say, a Foley catheter or an NG tube, or in the administration of medication or assessment of a pediatric client. I mean, it's pretty vast in terms of what is offered. And then they also have the opportunity, something that is new, is that we have 5 virtual interactions that relate to some of the skills. And so the students are presented with a client situation or a case study. And as you know, the NCSBN has developed the clinical judgment measurement model and has identified that action model. So every virtual interaction is going to carry the student through those 6 steps of the action model. And then they'll have the opportunity to document as they go along. So video case studies. So this is a really exciting opportunity for nurse educators to use or have small segments of stimulation in the class to stimulate thinking and the making of clinical judgments. So we've simplified this solution so it's really easy to assign. I would use this in class. There's a video, and then the students either respond, and they can respond verbally via their phone, or they can also type in. They can work on this as groups. And again, so these are small segments. Especially with the Gen Z learner, they don't like to read. They don't read much at all. And so what they prefer is to have small segments of content, and then they want to be able to test and apply their knowledge. And so this provides a great opportunity for that. Are you back, Ashley?
If you can hear me, then I'm back. I'll go with it.
Civility Mentor. Okay, I'll keep going. So Civility Mentor is a method of simulation or a simulation opportunity that Dr. Cynthia Clark helped us develop. And of course, you know her as the national and even international guru of civility. So if you think back to your first year of nursing practice, whenever I talk about Civility Mentor, I think back to the first time I worked a double shift and I was on a night shift and a client had a changing condition and I was very nervous about calling the physician. And so I probably paced the nurse's station for about 15 minutes, going over in my head what I wanted to say and what I was going to receive on the other end. And so I really wish I would have had an opportunity to have a tutorial like this. So these 4 modules, what they do is they introduce the concept of civility and how it affects patient care, patient safety, and then that promotes civility amongst their peers, how to manage a situation when you've got maybe a nurse educator or someone in a superior or managerial position that you're having a difficult time with, and then also how to transition to practice. And so this helps develop the confidence that students need in communication. Thank you for advancing that for me. Nurses Touch. So I've heard some discussion about soft skills, and Nurses Touch does provide simulation, which you see listed on the screen. When you go back to the research that the NCSBN did way back when they asked, are we measuring the right things in the questions that we're asking, they hired observational psychologists that identified the top 3 skills or talents that nurses perform. That top one, of course, is clinical judgment, and that's what the buzz is all about. And we know that through their research, 50% of all new grads are making errors, and 65% of those were identified as errors in clinical judgment. So tasks on the test plan are almost 40% of those are tied to clinical judgment. The second skill or talent that nurses perform is professional communication. So while it is a soft skill, it is the second most important talent that a nurse performs, and it's tied to 44% of the tasks on the NCLEX test plan. And then following that is active listening, which is tied to 38% of the tasks. So most important, clinical judgment, professional communication, and active listening. And so Nurses Touch provides nursing students with the opportunity to focus and practice those top 3 skills or talents. And so I also like to point out that wellness and self-care, when you look at, obviously right now we have multi-generational students, but all of us are learning online and probably prefer to learn online. None of us that were educated way back, like in the 80s, want to go back to a card. When we did our research, remember we used to research the cards in the drawers that took up this huge section of the library. Now we want to perform that online. And so as we look at this multi-generational group saturated by Gen Z, they have a tendency to be online for 10 plus hours a day. And so they have a sedentary lifestyle. So wellness and self-care is really important. So that's an area that we want to emphasize as well. And again, there are simulations in the areas of communication and leadership, offering students the opportunity to make decisions. Next slide, please. So within the communicator, there are virtual simulations. So Ashley mentioned that we have virtual and medical grade actors, so virtual humans. And they are reflective of a diverse population. The research that we've done on our end shows that nursing students, they like both, but when they're first learning, they really appreciate having a virtual human because it's not quite so intimidating. When you think about what we do as nurses, we are provided permission and opportunity to come into someone's personal or intimate space. And that can be difficult for a new nursing student that has not done that. And so these virtual simulations offer them that opportunity. And then on the next slide, I believe we have Health Assess. So Health Assessment also uses virtual humans. And there are 12 tutorials. So the first 3 introduce them to health assessment and then provides information on how to obtain a general survey and a health history. Then the last 9 go over the body systems. And so once they've learned those introductory tools, then they get to go through and learn how they're going to assess a body system. And I think one of the best parts is that they will learn about expected and unexpected findings. And so the other thing that the early research shows about Generation Z, so those are a lot of our college students, they don't pay great attention to detail because they're on the internet constantly and going from website to website. Watch them text. I'm a one-hand texter, and they're going like crazy with both hands. And so they're all over the place in terms of their attention, and their average attention span is 8 seconds. So for those of us that weren't raised on the internet, we're a little bit focused on details. So we have to help them see those details. So I really like that it's expected and unexpected because they need to pay close attention to detail. And I believe the next slide just goes into a little more depth in terms of our simulation. So we have virtual simulations in health assessment. There are 5 of them. And so they get to focus and see how to assess concentrated areas, more like a focused assessment, all the way up to a full body assessment. And our EHR tutor, our EHR electronic health record documentation, is incorporated into that so that they can practice that documentation before they go to the clinical setting, because you know how long that can take as they're writing something up for it to be approved. Within our electronic health record, we have 150 pre-built patient charts, so you don't have to stop and try to develop your own. Now, if you have that perfect patient that you wish every student could be exposed to, you could develop that within the EHR tutor. We also have realistic barcode scanning and digital dispensing with EHR Tutor. It's a very simple electronic health record. It was designed by a nurse for nurses because she got frustrated with how complex and how unrelated to nursing care some EHRs are. So really exciting at ATI. So we have real life clinical reasoning scenarios, and this is where we use medical grade actors. So the medical grade actors provide an emotional fidelity, and then the branching logic provides a practice fidelity. So you can see we have these in the areas of med-surg, nursing care of children, maternal, newborn, and mental health. And this is where the student is the driver in terms of assessment and providing care. If you go to the next slide, please, what you will see is an example of the power of branching logic. So as pretty as this slide is, as intricate and as much as students can learn, it's fun and it helps them practice before they go to the clinical setting. If they make a mistake, it's a safe place to make that mistake. And so they start with a video presentation of a client, and then depending upon how they answer that question, it will unfold in 4 different ways, and they will watch more video of the client depending upon how they answered the last question. So it could be that they're choosing optimal decisions and the client's doing very well, and that's good. It could be that maybe they chose a suboptimal decision, but it was okay. They'll be able to recover. I mean, because many of us have done that in practice. Then there could be suboptimal decisions where we may or may not be able to recover. And finally, they may make a decision that is very detrimental to the client. And so then they're exited from the program. Think about that for a little bit. And then depending upon how you've assigned it, they can go back in. Now, what the NCSBN, if you listen to Dr. Phil Dickinson, who is leading this crusade, if you will, I love him and I love to follow him, for Next Gen NCLEX, it is still on target to be released in 2023 of April. What they're looking for beyond that, when they have the capability of having more rich media within the questions, is the developing of branching logic questions. So we're pretty excited at ATI because we've been working on this for a few years. And very pleased that we were able to help a number of programs last spring and fall and even into this year with replacement of clinical hours. As Ashley mentioned earlier, for PM students, it's 400 plus hours, depending upon how many of our solutions they use. Next slide, please. Thank you. So this has been a big change for a lot of faculty. The average age nurse educator professor is 60. So that's a boomer. That's like me. And so we didn't learn online. And so this has been a huge change and a huge transition. So last spring, within 2 weeks, we have a nurse educator on our team that worked with some other nurse educators, but I call her out because she's an Axel certified. And so what she did within these lesson plans is ensure that the Axel standards are embedded. And so these lesson plans, there's a variety of them. You can use them as a clinical replacement where the student works on their own, or perhaps with a buddy, because they really learn better when they help teach each other, in a modified flipped classroom, or also in a small group. And now we have these virtual plans. So educators can use them online as they're teaching virtually. And the videos can be paused or stopped at any time. You can bring your experience into the setting to make it that much more rich. So we have a lot of support for nurse educators. We have integration specialists, nurse educators that help with the implementation. I help with the implementation. Our sales team helps with it. We support you however you need to be supported. The next slide. In the spirit of supporting nurse educators, the ATI Academy is available to any client that has one of our packages or bundles. And there is information about ATI and even becoming an ATI champion so that you know the ins and outs of our solutions. We have product training within that academy. We also have the opportunity for you to have professional development. As many hours as you would like. Those are updated all the time. And we just had an interview with our CNO and Dr. Phil Dickinson. That's been placed up there, and all kinds of opportunities for you to learn from. We offer a summit every year, except for last year because of the pandemic. And so at that summit, we welcome nurse educators and have all kinds of education opportunities for those educators that attend. For those that aren't able to attend, we post those on the ATI Academy. So it's almost like you were there. And next slide. That's it. So I guess in summary, I just want to let you know that we are focused on clinical judgment and making sure that students have the opportunity to practice that before they go into a clinical setting, and having the opportunities to make mistakes in a safe environment where they can learn from those. I guess we'll open it up for questions.
All right, we have opened up the Q&A panel. Again, if any board members have any questions, you can either raise your hand or type your question into the chat box. For our public attendees, you can type your questions into the Q&A panel by clicking on the Q&A icon on your screen.
And also, what I would like to offer is that we will be doing a live demonstration next Thursday. I believe that's the 25th from noon to 2 o'clock. If anybody would like to participate or see a demonstration, we'll have some fun.
Please send your request to Ashley, ASHLIE.Allen, ALLEN @atitesting.com. And we'll send you the invite.
All right, the first question we have is, how would you implement pre-brief and debrief?
Okay, so that's a great question because I forgot to mention that when I was talking about the lesson plans. So the lesson plans are very detailed. It starts out with the pre-briefing. So there are assignments for nursing students, and they're listed out really like a recipe card, so that if you're feeling not very creative or you're exhausted, like a lot of nurse educators are now, it actually says this is what the nursing student should do. And it incorporates all of our solutions. And now you may not have all of them, but we make the recommendations on what would be appropriate. And then there are the pre-briefing questions that you as a faculty member may ask. So again, if you're not feeling creative, we've got questions right there to support you with. Then they perform the simulation, and of course you can use that as you like. And then to tie it up, there is debriefing. So there are debriefing questions inserted or offered to you if you don't have questions of your own. So this lesson plan really walks you through every single step of the learning process in using simulation.
And what is the importance of pre-brief and debrief?
What is the importance? Is that what the question was?
Yes.
Catherine, what's the importance of the pre-briefing and the debriefing?
Yes, got it. Well, so the pre-brief is where they're able to apply that information that they've learned. So if you think back on the learning loop, and it guides them in new learning opportunities and allows them to know what's expected of them and what the assignment will include. And then the debriefing brings all of what they've done in their pre-briefing and their simulation together, making that learning environment richer.
Okay, and then what are some areas that your organization has identified?
Many of our simulations. Go ahead.
What are some areas that your organization has identified as challenges or limitations for vocational nursing programs?
So I think some of the limitations are pretty have changed over the last 12 months with the pandemic, but obviously the clinical sites continue to be a challenge, whether pandemic or no pandemic, right? The availability of those sites is continuous challenge for both RN and the VN groups. But I think that, and then also the different types of learners that are sitting in the classroom. It's not necessarily, you know, when I was in school, everybody was 18 years old sitting next to me. And now it ranges from somebody who's 18 to, you know, who knows what age. But so I think for faculty and instructors to be able to teach to each one of those individuals learning abilities and learning strengths continues to be a challenge. And we address that in not only the ATI Academy, how to do that, but also we work very hard with our solutions to ensure that different types of learners are addressed throughout. Catherine, I don't know if you want to add anything.
I think that's good. We support faculty, so if they're unaware of what the changes are with the NCSBN or these new learners, we provide in-service with that as well.
And next question, will additional real-life scenarios be added for the LVN?
Yes, we are currently, we are always working on broadening the scope that we have, but yes, we are planning on adding additional scenarios for the VN. And as a follow-up, I don't know what they are off the top of my head, if that was your follow-up question, but yes, we are always broadening the scope of our resources, particularly for VN at this time.
And our lesson plans also help call out scope of practice differences between PN and RN. So our RN solutions, as long as a faculty member is guiding a PN student, could be used in that manner.
One thing I did want to mention is these resources are available to students for a full year after graduation, so they can use them as they prepare to take their exams.
And next question, can you further explain digital dispensing of medication?
Catherine, I'll let you take that one.
Yes, so we have, sure, thanks. Yes, so the digital dispensing, we have over 2,000 medications within the system. And so labels can be printed off and attached to medications. You don't have to have a big fancy Pyxis cart unless you already have one. That's great. You can make your own cart, something that would cost you maybe $25, $30, and we're compatible with that. I mean, obviously it doesn't pop the door open like with a Pyxis, but you can simulate what it is like administer a medication. I think it's, in some ways, I think it's good practice for them to have to identify and to actually select the medication because they always want to make that check. They can use a scanner to scan the medication and then also to scan the patient's ID band. And if you have a medication that is not in our menu, if you will, you just have to let us know, and we will forward that to the IT team, and they will add it.
All right, that looks like all the questions at this time, and we have reached the end of our time for this presentation and question and answers. We will now be proceeding into our lunch break. Thank you, Sandra, Ashley, and Catherine, for your presentation today.
Thank you, everybody.
We will be taking a lunch break now, and we will resume at 1:15.